Hello guys, how are you? Hope so you are doing well. So I'm Dr. Devyani from doctor.dentico and today our discussion is on case history. I have taken reference from Anil Gom for oral medicine and Nilima Malik for oral surgery. But mostly I have covered this video from Nilima Malik because I am covering this topic under oral surgery. And for oral medicine case history and public health dentistry case history, I will make separate video. So stay tuned. So we will start with the definition, which is very important viva question in any department. So definition of case history is a planned professional conversation that enables patient to communicate his symptoms, feelings and fears to clinician so that nature of patient's real and suspected illness and mental attitude may be determined. Now, moving to the introduction, why are we taking case history? To make a correct diagnosis. And what is the diagnostic sequence? So, in diagnostic sequence, we have a 5 step. The first one is history taking, then clinical examination, radiological analysis, lab investigation. The last is interpretation and final diagnosis. After making the final diagnosis, we will move towards the treatment plan and then treatment. So, now what are the aims and objectives of this pre-operative assessment? It is for the choice of anesthesia, whether the patient can withstand general anesthesia or not, whether the patient can withstand the trauma of surgery, whether any abnormalities are present or not, and the choice of pre-medication. In some diseases, we have to give pre-medication before any oral surgical treatment. Such as in infective endocarditis, we have to start a dose of antibiotics before the treatment. Then we need to choose the proper treatment plan. Now, in history taking, we have a 6 steps. The first one is to collect the general information, then chief complaint, past medical history, past dental history, personal and family history, and the examination. In examination, we will cover extraoral and intraoral examination. So, starting with general information, we have to ask patients name, age, sex, marital status, address, race, and occupation. By knowing the patient's name, it will give a psychological benefit. It means whenever you call patient by the name, it will make the patient feel good. In pedo patients, it means child. Whenever we call them by their pet name, it will encourage them to talk freely. What are the advantages? To maintain a proper record, to make easy communication, and as you know, for psychological benefit. Now, what is the significance of age in case history? To make a correct diagnosis because certain diseases are common at certain ages. For example, at birth, we can find a predeciduous dentition and cleft lip and cleft palate. Another thing is for treatment planning. At a certain age, some teeth are absent, right? So we can see that if the patient is of a certain age, that's why these teeth are absent. So absence of teeth, then delayed eruption we can find, and also we can diagnose ankylosed deciduous teeth. Then to check a behavior management technique in pedo patients, we have to follow this behavior management technique. Now to decide the dose, so according to age we are giving dose. For those we have a 3 formula like Young formula, Clark formula and Dealing formula. Now moving to sex. Whenever it comes to diagnosing certain disease, it is important to consider sex. Why? Because like for example, anemia is more common in females while attrition is more common in male patient. Then, whenever we are dealing with pediatric patients, the gender can influence the choice of gift, such as soft toys can be given to female patients and racing cars to male patients. Then, aesthetics also play a role as females tend to be more concerned about appearance. Then, for dose calculation, it should be considered because females have less surface area of body and lesser body weight, so they require lower dose than males. Then, drug can interact female and male both differently. For example, in females, we have to know menstruation period, pregnancy, and lactation period of female because whatever drugs you are giving, it can affect her, right? So, suppose patient is pregnant, so whatever drug you are giving, it can affect fetus. So you have to prescribe a drug like that. Then in male patient, it can affect a hormonal levels to male. For example, antihypertensive drug can can affect a sexual function of males. Right after this we have a address information, why it is important for future co-response and geographical prevalence of any dental or oral diseases. Like in domestic water, if fluoride content is very high, so in this area we can find a more fluorosis patient. And other than this, we can find out some medical diseases as well. For example, you will find malnutrition and anemia in rural areas, where you will find obesity in urban areas. Okay, after this, moving to registration number, so it will help to maintain accurate records, right? Especially when you are dealing with patients who have similar names. So, whenever patient visit to you and you are just typing this registration number in your computer, so you can see all the past treatment and future treatment plans for these patients. Now, occupation. So, it can impact a patient's financial status, right? So, they cannot afford a costly treatment, right? Then some diseases are connected with occupation. For example, abrasive dust can cause attrition. Carpenters, shoemakers, and tailors have habit of holding sharp things in their anterior teeth, so they have abrasion. Then varicose vein can be seen in occupation of long standing, for example, bus conductors. Then, urinary bladder neoplasm can be seen in aniline dye workers. And after this, scheduling appointments according to their occupation, right? And also in pedo patients, when both the parents are working, so you have to appoint them according to this occupation, right? Now, moving to religion. So, specific diseases are common in certain religion. For example, carcinoma of penis, phimosis, and intersuspection. Then, concept of chief complaint. It refers to patient's response to dentist question, and it is a main reason for patient to visit your clinic, right? So, it should be recorded in patient's own word, and first attention should be given to this. Why we are recording this in patient's own word? For medical legal aspect, and different doctors may have different reviews, right? So if you have recorded chief complaint in patient's own words, so doctors can make a correct diagnosis. Then it should be recorded chronologically because we have to see from where this problem started and how it is going, right? And if patient is giving you a simultaneously complaints, then you have to describe it according to severity, okay? And don't interrupt whenever patient is telling you a chief complaint, because it can change chief complaint and your diagnosis. Then what is the significance of this chief complaint? So it will give you a correct diagnosis and to make a correct treatment plan. Okay. Now, for example, if patient come to your clinic with complaint of pain, then how you will going to record this chief complaint? So you have to ask mainly three questions to this patient. Which three questions? First, what is your complaint? Okay, what are you feeling? Then second, region of pain, it means location of pain. And the third is time duration since patient have this complaint. Okay, so how you will write this? So you have to write like this: patient complaints of pain in, then region, right? First is what is your feeling, pain, then region. In lower, then you have to ask upper lower, suppose patient say lower. Then right left, suppose left. Front or back, patient say back. Tooth or gum, patient will say tooth region. Okay, this is region. Then you have to ask a duration, so since 5 days. Okay, this is a proper recording of chief complaint. Now moving forward to history of present illness, or we can say HOPI. It should be recorded in a chronological order. Okay, so starting from when the problem began. So it is nothing but just a collecting information. So from when the problem began to what did you notice first. Then it means initial observation by patient, and then any problems or symptoms related to this, then better or worse at any time, then what you have done to treat these symptoms and any consultancy or not. So you have to ask like when this problem begin. So patient will answer like, for example, patient tell you that I was just eating an apple. So it was starting with eating an apple, okay? And suddenly I heard a breaking sound from my teeth. So first thing which patient noticed is breaking sound. Then patient said, then after this I just felt a pain in this region, and with the pain it can be possible that I got some burning sensation or anything. Patient will tell you, right? So any problems and symptoms related to this you have to note. Then better or worse at any time, it means patient will complain like in morning I don't have any pain, but in night I have a worse pain. Okay, so you have to mention this thing. Then what you have done to treat these symptoms. Sometimes patient just go to nearby medical, or sometimes patient take painkillers by themselves, and then you have to ask any consultancy for this. Do you have consult your family doctor or any dentist? Then we have to ask a mode of onset. So what is mode of onset? We have to ask, does this complaint start suddenly or gradually? So patient will tell you, first I don't have any pain, then suddenly it started, or gradually it is increasing. So you should know a mode of onset. Then what was the cause of this onset? So we have to start from the first, that patient was eating an apple, or we can write a patient had a hard bite on a food, and because of this they start this pain. Then what is the duration? So it should be noted that since how many days complaint was present. Then progress. So there are three types of progress. It can be intermittent, recurrent or constant. What is intermittent? That सुबह था लेकिन दोपहर को चला गया लेकिन वापस थोड़ी देर में आ गया, दैट इज इंटरमिटेंट. देन व्हाट इज रिकरेंट? 2 महीनों पहले था, खत्म हो गया, वापस आया. ओके, दैट इज रिकरेंट. देन शुरू ही है, पूरा दिन दर्द होता ही है, दैट इज कांस्टेंट. देन रिलैप्स एंड remission. So what is relapse? That patient has got any similar complaint in the past and then again it relapses. Then we have to ask any treatment you have done before this for same problem. Now recording of negative history. So whenever patient visit to you and telling his chief complaint, you are just starting making a provisional diagnosis list in your head, right? So for example, patient come to you and his age is 18 years and his complaint is restricted mouth opening. Restricted mouth opening. So by this you are just making a provisional diagnostic list, like it can be because of third molar eruption, or it can be because of OSMF, or it can be because of any fracture. Right? This is just a provisional diagnostic list which you have made in your head. So now you will ask patient, do you have any habit of tobacco chewing? Patient will say, no, I don't have any habit of tobacco chewing. So you can exclude this OSMF, right? So this OSMF is a negative diagnosis. It means it is not there. So this habit of tobacco chewing is negative history, right? Then do you have any trauma history for this? Patient say, no, I don't have any trauma history. So it is not a fracture. So negative history of trauma. So now you can think that it can be because of third molar eruption, right? Now moving to a past medical history. So what are the goals for medical history? To assess in diagnosis of oral diseases, detection of underlying systemic problems, then management of patient, and the last is consultation with other professionals. So in medical history, you have to record any serious disorder or any disease related to any system. Like for example, you have to start with respiratory system. You have to start with CVS system, then respiratory, then CNS and gastric system. All the system disorder you have to ask the patient, do you have any disorder or any diseases related to this any of systems? Then also you have to ask any infectious disease. Then you have to record any childhood illness or birth trauma. Childhood illness or birth trauma history. Then you have to ask patient details of previous hospitalization. Then any past or present history of any drugs. Are you taking any drug right now? Other than this, you have to ask any blood transfusion history. After all those things, you are done with your medical history. But mainly, you have to ask aspirin, right? Before going to any oral surgical procedure, we have to ask all the drugs, but this is a very common drug which patients are taking in India, okay, for CVS. Now moving to a past dental history. So why we are recording this dental history? to check a patient attitude towards the past dental treatment. In this, you have to see these components which that previous restoration, perio treatment, endo treatment, OS treatment, any previous ortho appliances, any dental prosthesis and any radiation therapy in head and neck region. Okay, now next is recording a personal history. In this, you have to ask any habits and addictions to the patient. So most commonly, patient have habit of tobacco chewing or smoking or alcohol. So if any one of this habit is there, you have to ask frequency per day. So, for example, patient have habit of tobacco chewing, then you have to ask how many packets you are taking in a day. 1, 2, 3, whatever patient tell. Then length of time. It means how many years you are taking tobacco. Okay, so after this we have a oral hygiene and brushing technique. So, based on oral hygiene, you can make a provisional diagnosis like bad oral hygiene and improper brushing technique may lead to dental caries and periodontal diseases. Like if patient have a horizontal brushing technique, it can lead to cervical abrasion. Okay, then any pressure habit is there or not, like lip sucking, thumb sucking, finger sucking, all this pressure habit you have to record because it can lead to anterior proclination of maxillary anterior teeth. After this, we have a tongue thrusting habit which can lead to anterior and posterior open bite and proclination of anterior teeth. Then we have a mouth breathing. In this patient, you will find anterior marginal gingivitis, then habit of bobby pin opening. So mostly in teenage girls, you can see they have habit to hold bobby pin in anterior incisors. So in this patients, you will find notching of incisors. Then other than this patient can have habit of nail biting, pencil biting or lip biting which can lead to upper anterior retroclination of lower anterior teeth. Then other than this patient may have a habit of bruxism which can lead to attrition. Now you have to record patient appetite as well because it can affect its dental health. So, in patient appetite, we have to record whether it is regular or irregular, and you have to ask a type of diet. They are vegetarian or non-vegetarian. They are taking soft diet or coarse diet. So, in the soft diet patient, soft diet will easily adhere to teeth and it will not remove itself. So, for this patient, we can find more dental caries. Now suppose patient is taking a coarse diet. In this patient you are seeing more attrition of teeth. Now moving to next which is social status. So in social status it's like in a high level and middle class patients you will find a caries or atherosclerosis, right? But in low social status you will find malnutrition and anemia and infectious disease like tuberculosis. कि बड़े लोग बड़े डिसीज होंगे, छोटे लोग छोटे डिसीजेस होंगे. Then you have to record a travel abroad history because in a very tough time like COVID, we have to take a broad history because it can be possible that patient may suffer from any infections from abroad. Then noticing of family history. Why we are taking family history properly? To check any hereditary diseases, for example hemophilia and diabetes mellitus. Other than this, you have to see any allergy history to drug or any food, then immunization history you have to record. Now, this was all about a recording a case history. Now, it's dentist turn to examine the patient. So, We will start with clinical examination. So whenever patient enters in your clinic, you are just noticing his gait and build, all those things, right? So in clinical examination, we have to check gait of patient, composure of patient, speech of patient, general condition, and psychological status of patient. Then you have to record vital signs of patients like blood pressure, pulse, temperature, and respiratory rate. After this, you are starting main extraoral examination. In extraoral examination, we have to examine face, skin, and soft tissues, then skull, bony skeleton of face, TMJ, lymphatic system, salivary glands, and eyes. So in this, you have to follow these four things. The first one is inspection. In inspection, you have to inspect any asymmetry is present in face or not. Then any swellings and proportion of upper, middle and lower thirds of face and their relation to each other. So we are just dividing face in three planes. So upper, middle and lower, right? So you have to check this proportion. Then you have to go for morphology. According to morphology, we have three types: dolichocephalic, mesencephalic and brachycephalic. So dolichocephalic have a face of long and narrow, and mesencephalic have a medium type of face. I'm just telling this to understand you, okay? Then brachycephalic is a wide and small face, rounded like. Okay, this is a brachycephalic. Then moving to skin and soft tissue. For this, you have to examine a color and texture of skin and soft tissue. So this is a chart from Nilima Malik, which we have to refer. That if you find in this, we have some important things like pallor, any abnormal redness, then cyanosis is important for us. Okay, then yellow color is important. So if you find a pallor of skin, you can diagnose like it can be because of shock, hemorrhage or intense emotion, or because of persistent anemia. Then in abnormal redness, you can diagnose overheating, extreme exertion, sunburn, febrile exanthemosis, and inflammatory skin disease. In cyanosis, because of defective oxygenation of the blood, excessive decrease in the hemoglobin level. In yellow, you can check about jaundice. Okay. Now next is skull. So in skull, you have to check any abnormality in size and shape of cranium. So according to that, you will find any congenital abnormality is present or not. Then any trauma history you have to check. For trauma cases, you will find edema, laceration, swelling, depression in contour of skull and frontal bone injury. Okay. Now moving to eyes. In eyes, you have to examine any soft tissue injury to cornea or conjunctiva. And you have to inspect pallor, icterus and exophthalmos. So, if you find a pallor in eyes, you will see that patient can have anemia. In icterus, you can find out jaundice. And exophthalmos, with mostly it is occur in trauma patient, but if it is not trauma, then it can be because of thyroid disorders. Okay. Other than this, you have to check injury to orbital skeleton. Okay. Now moving to a nose. So if there is any depression of nasal bridge or deviation of nasal septum is there, so it is indicative of fracture of nasal bones. Other than this, if you find obliteration of lateral wall of nose and deviation of nasal septum, it is indicative of tumors of maxilla or maxillary sinus or nose. After this, examine ears, which is most important in trauma cases. So if you find bleeding from ears, it can be because of condylar fracture. And we can diagnose golden heart syndromes on basis of ears. In this syndrome, that external ear is missing, only ear tag is present. Now moving to lips. In lips, you have to examine any cleft, ulcer, angular cheilitis, or any herpes infection. After this, we are moving towards palpation, which must be done gently without causing much distress to patient. So you have to palpate all these parts. Which parts? Supraorbital ridges, lateral orbital rim, medial orbital rim, infraorbital rim, bridge of nose, lateral nasal walls, paranasal region, zygomatic bone, TMJs, posterior border of ramus, angle, the continuity of inferior border of mandible, salivary glands in disorders. So this is image from Lima Malik. In this you can see how to palpate all those regions. So we in first image we can see palpation of supraorbital ridge. Then in second we can see infraorbital ridge palpation. Then third is checking the nasal bones or bridge or maxilla and its mobility and integrity in case of trauma. We will cover all those palpation in trauma chapter, and this nose and maxilla mobility we have to check in mostly Lefort fractures. Okay, then checking the higher region fracture of maxilla, then bimanual palpation for lesion which is present in floor of mouth, then checking the mobility of mandibular bone in case of fracture, then TMJ examination, and the last one is endural TMJ movement examination. Okay, so other than this, you have to palpate lymph nodes. Okay, in cases of infection, you have to palpate this lymph node because without infection, you cannot palpate lymph nodes. So this is most important chairside viva question. Examiner will ask you to show them proper lymph node palpation techniques. So you should know location of each and every lymph node. So in this you can see this is a pre-auricular, just front to ears. Then this is a post-auricular lymph node behind the ears. This is a submental lymph nodes. Then this is submandibular lymph nodes. After this we have a jugulodigastric lymph nodes. Then jugulo-omohyoid lymph nodes, and last is supraclavicular lymph nodes. These lymph nodes are palpable according to their infection spread. Next is TMJ palpation. So this is the technique of TMJ palpation. In this diagram, we can see that dentist is palpating lateral aspect of joint with mouth closed, then lateral aspect of joint during opening and closing, and the last is with the patient's mouth fully open. Okay, and in this the clinician moves a finger behind the condyle to palpate the posterior aspect of the joint. Other than this, in Anil Gom, it is given that TMJ palpation technique, which is of two type. The first one is pre-tragus palpation, and the second one is intra-auricular. As the name suggests, in pre-tragus, the patient should be requested to slowly open and close the mouth while the doctor bilaterally palpates the pre-tragus depression with his or her index fingers. So in this diagram, you can see that when you ask patient to open and close the mouth, in this you have to place your finger in pre-tragus depression, and you can feel a condyle is moving and any sound you can hear, right? Then second technique is intra-auricular. In this You have to insert your small fingers into ear canal and pressing it anteriorly and ask patient to open and close the mouth. Okay. The next is auscultation. In auscultation, you have to check vascular lesion to hear bruits and TMJ pathological processes to hear TMJ movements, right? Then after this, you have to check opening of mouth, which means interincisal distance you have to record. Commonly, it is about to 35 to 50 mm in adult. Okay. After this, we will now move to intraoral examination. So, in intraoral examination, you have to examine buccal, labial, and alveolar mucosa, then hard and soft palate, then floor of mouth and tongue, retromolar region, posterior pharyngeal wall, and facial pillars, then salivary glands and its orifices, and the last is dentition and occlusion. So, we will start with inspection for intraoral. So in inspection, first you have to inspect oral hygiene of patient. So if there is a bad oral hygiene and halitosis is there, so it is indicative of more caries and periodontal diseases. Then second is to examine mucosa for its color, texture and presence of any ulceration or growth or any draining sinus. After this, you have to examine a size of tongue like macroglossia and microglossia, then mobility of tongue and the surfaces of tongue. Then you have to examine uvula, soft palate, lateral and posterior pharyngeal walls. After this, you have to examine a floor of mouth to note any inflammation, mass or hematoma is present or not. After checking this, if you find out any hematoma in floor of mouth, it is an indicative of fracture in that region. Now you have to examine salivary gland orifices for any signs of inflammation or post discharge. Then you have to now examine a dentition. In this, you have to mention missing teeth, carious teeth, mobility, restoration, and malposed teeth. And then you have to go for occlusion. In occlusion, you have to check any deviation from normal in canine or premolar region, anterior open bite, deep bite, then reverse over jet. All those things should be recorded. And after this, now you have to examine a periodontal tissues to make to see color and texture of gingiva and any signs of recession or hyperplasia or infection. Then in edentulous ridges, you have to examine a form of ridge, any soft tissue abnormality or any bony abnormality like tori, bony protuberance, all those things. After this, you have to palpate intraorally present regions. Suppose patient have a swelling. In this, you have to palpate the swelling for consistency, extent, and to check either swelling is facile or pedunculated. Then, if any vascular lesion is present, you have to palpate that. Then, in trauma patient, you have to palpate in a sequence. So, you have to start with anterior maxillary region, then zygomatic buttress, then tuberosity region, then anterior border of ramus, then downwards vestibule, then anterior mandibular region. So this palpation of trauma patient will be covered in trauma classes for better understanding. So this was all about case history. After this, we will discuss diagnostic aids in oral surgery, radiological findings, right? So this was all about today. Thank you so much for patience listening
And if you have any doubt, let me know in comment section. I will definitely respond you. Thank you so much.